Okay, it's time to talk about nitroprusside. So the clinical case here, a 28-year-old African American presents to the emergency room complaining of severe pounding headaches. As you question him further about his symptoms, he also tells you that his vision has become blurry over the past few hours. Physical examination reveals a well-nourished man who appears disoriented, with a blood pressure of 230 of 110. You diagnose the patient with hypertensive emergency, and you decide to start him on intravenous medication that will cause direct vasodilation of peripheral veins and arteries in order to reduce his blood pressure. So this is a hypertensive emergency, so I'm just going to highlight this on my Lang pharmacology flashcards is what I'm looking at. So nitroprusside is metabolized into nitric oxide in the bloodstream. So similar to what we were reading about, nitric oxide, nitroglycerin, it acts to stimulate guanylate cyclase, thereby increasing cGMP synthesis, which leads to elevated levels of cGMP. This leads to dephosphorylation and deactivation of myosin light chain, which thereby results in smooth muscle relaxation of peripheral veins and arteries. The result is a reduction in peripheral vascular resistance and venous return, afterload and preload. So the clinical uses, this is acute management of hypertensive crisis or in severe heart failure. Side effects: cyanide toxicity, orthostatic hypertension, as with nitroglycerin, and metabolic acidosis, arrhythmias. And nitroprusside can only be given intravenously, since oral administration results in the formation of cyanide via hydrolysis of nitroprusside in the GI tract. If cyanide toxicity results after nitroprusside use, the patient can be treated with thiosulfate. So, clinical use: hypertensive crisis, severe heart failure, and it works. Nitroprusside works just like nitroglycerin. It opens the veins. Veins and arteries. So, thank you very much. I hope that was helpful.